Welcome everyone to this week's podcast video edition of the Emergency Department Provider Updates. I am providing this as a alternative if people want to listen and watch this as opposed to reading through the updates or do both or either. That is up to you, but I wanted to give you guys a little something different if you're interested. I'm just going to kind of read through this stuff and go over some of the highlights that I think are more important. This is the week of 8/8/2022. Currently, there are 14 COVID inpatients, and that's a little bit of an uptick for the last couple days. Wanted to remind people that we are having a great CME available talk on serotonin syndrome this Wednesday in WEGI 123. That's August 10th at 1 p.m. I wanted to remind people to order the COVID test and try to order it early in the admission process. There's been some admissions where it got delayed significantly because it wasn't ordered. I've asked nursing to work with us, and if they don't see it in, to either do that as a verbal order, but they need to know whether it's the lab 888 or whether it's the rapid. So work with them on that. There's some new information in the attachments about monkeypox. A couple of the highlights: make sure that you're putting suspected people in monkeypox in droplet and contact precautions like COVID-19 patients. And also, apparently, we've ordered the test wrong a couple times. The test should be miscellaneous test, which is lab 000 in Epic. I would encourage everyone to use the job aid for that, which is available on the SharePoint website. So we'll go over that in a moment. There's a link to a survey here on your Epic proficiency. This should take less than 3 minutes. I would encourage everyone to do that. That's going to help us gauge what additional Epic training we need to do. Nick Rademacher was looking through some of our overdose cases as part of our MOUD program. He was noting that we've had several overdoses where MOUD was not discussed, or at least it wasn't documented. So please remember to discuss that with our overdose patients. It's a potentially life-saving treatment. And I suspect that some of you probably are, but try to document that also so that when they come back again, we know what conversations have already taken place, so that we can go from there. We are going through the Emergency Cares campaign again, and this week's topic is mindfulness. Encourage everyone to focus on that for their own well-being. This Friday, we'll begin a transparent lockdown, which means basically no customizations from 5 p.m. Friday, August 12th, until about 11:30 p.m. Saturday evening on the 13th. And then there'll be a 10-minute environmental pause where some brief updates are added to Epic. And then the last thing I want to go over is our safety, quality, and patient experience, which is kind of the hallmark of what we do. So we'll get into that here shortly. I'd like to also call out people who have distributed Narcan kits in the last couple weeks or so. We've got Stringer, Miller, Strokus did 2, Anderson with Resident Collier, Brock, Zimmerman, Rademacher did 5, Jake Barnett, Corey, Dave Whalen, Byron Druskel, and Mark Figursky. Great job, guys. All right, let's scroll through this week's nursing shift report. You can see we've got some numbers here. Some of our numbers have been a little bit lower this week. We had a 138 and 3 in the 150s, but some higher ones also, 183, 178. Patrick Fuller is back as a PCA. I'm going to let you guys read through. This is mostly nursing stuff. We have some education on the the NG tubes. So make sure that you are coordinating with nursing. You've got this filter here so they don't puke out of the air vent, and we need to make sure we're using the right size connector to the hose so that it actually sucks when it's supposed to suck. This is the job aid, which is on the SharePoint website. If you don't know how to get to it, you basically you go to our site, and then it's right in the infectious disease, infection control library, and then there's a monkeypox, and then it's right there, the job aid. So this will show you that you need these 2 swabs. I would encourage you to open this up. I modified this today to include a screenshot of the order because apparently we didn't order it right a couple times. The order is miscellaneous test lab 000, and then in the comments you specify send specimen to state lab for monkeypox testing. There's also this form that you'll want to print off. This isn't as bad as it looks. It's basically just some demographics on the patient. And then the rest of it is just instructions. So all that's just instructions. Here's another info sheet on monkeypox. Shows you some pictures of the different vesicular lesions. The main purpose of this is to remind everyone that this is contact and droplet precautions. This is a safety alert. I don't think we have any of these doors in the ED, but in other places in the hospital, if you see a door that has what appears to be a keyhole, it's not actually a keyhole. You can just stick anything in there and use it to unlock the door in case like a patient or somebody locks themselves in such a location. Oh, that's too much. Let me go back. All right, mindfulness, the act of paying deliberate attention to the present moment with an attitude of non-judgment, acceptance, and awareness. Practicing mindfulness is an acknowledgement that when we're knocked off balance or caught up in stress, there's value to having a practice to settle ourselves in any given moment. Always a good idea. There's some references here and a couple videos that would be a great idea to look through if you're interested in improving your mindfulness. That's it for the updates. I do want to go over this next section. This is a quality, safety, and experience report. We have some nice things to celebrate in here. And a few months ago, I talked about Trinity Health's Zero Harm initiative for a high reliability organization. And I just want to coordinate that with the rest of the hospital so that as providers, you know what we're focusing on and the things that we're celebrating on and working hard together on. So we are aiming to be a high reliability organization. These are organizations that are expected to have no errors. Organizations that you might think of would be, for instance, like the airline industry, nuclear power, those kinds of industries are considered high reliability. It's our goal to be that as well. Call to action is to not only promise safety, but to deliver safety within our organizations, which requires kind of collective action and accountability for all of us. We've talked about the Swiss cheese model before. This is how errors occur. You build in multiple layers to try to prevent errors, but none of those layers is always 100% effective. There's holes in each of those layers. The idea is to make those holes as small and as few as possible and put as many layers of protection in to prevent anything from being able to go directly through all the holes and create patient harm or errors. One of the things that the hospital is focusing on is celebrating and documenting near misses or good catches. So this is when, you know, something maybe made it through one of those layers of the Swiss cheese, but was caught. That gives us the opportunity to celebrate that that our process is working to prevent the errors, but it also gives us the opportunity to go back and look at that first layer that the error went through and see if we can improve that. So like an example within our department was that this week a nurse pulled Tylenol out of the 500 milligram container within the Pyxis. And when she was scanning them, she realized that they were actually 350 milligram tablets instead of 500 milligram tablets. She went back and saw that there are separate drawers for the 350s and the 500s. So that med scanning caught that error when somebody loaded the wrong tablets into the drawer. So now they can go back and provide some additional awareness, making sure they know there's two different drawers for those. So that's a good catch, and that's just an example. As providers, we want to celebrate that as well. You know, nurses are catching stuff that we're doing all the time, and we're catching stuff that they're doing. We really want to celebrate that culture. Together Safe Toolkit. You've seen this once before, but just to remind you, prepare for the process and manage the task, support your team, peer checking and peer coaching, communicate clearly. So the readbacks, clarifications of numbers, making sure that attitude and culture are part of this, the safety culture and the stop the line if there's concern for a safety concern, and then attention to detail. One of the things we want to focus for specifically for August is timeouts, briefs, and debriefs. So especially in the emergency department, if you have a resuscitation or a procedure, something like that, making sure to focus on the timeout beforehand, explaining what's going to happen, and in the case of things like resuscitations, debriefs to understand what went well and what we can learn from. I'm going to skip over this. Our dashboard, I'll let you guys read through this in greater detail. The very last column here is the year to date, and you can see our Southwest Emergency Department is 80.1, and this is likelihood to recommend. Downtown was 69.8, and these are, as you'll see in a moment, significantly improved and something to be celebrated. What's happening in patient safety, the Good Catch program is what I wanted to highlight with this. Infection prevention, this is kind of our latest line graph of our COVID census. You can see that we kind of went through the 1, 2, 3, the 4, and then a quick 5 with Delta and Omicron. And now we're kind of smoldering. I'm not sure we're calling this necessarily a surge, but we are kind of in this uptick in the BA4, BA5 variants, which we know are much more infectious than the previous ones, but we're still not seeing a ton of hospitalizations. And I think many suspect that that's because so many people are either previously infected or previously vaccinated, that there's a higher level of native immunity for these, and people that are getting sick for the second or third time, or they're getting sick on top of being vaccinated. Colleague safety. The no tolerance for violence basically originated from the emergency department. That is going hospital-wide, and we've got some hospital-wide education coming out on that, hopefully some video even in September. Experience of care. You know, the experience of care really goes hand in hand with quality of care. You can't really have one without the other. So it is a priority, and that's why it's in this quality report. These are our numbers, slightly updated from a couple weeks ago when I had these. You can see we hit 69.8, which is just shy of our goal, which was an incredibly ambitious goal, which was not set by us, by the way. It was kind of a Michigan Trinity goal based on our census and such. So that upward trend is definitely to be celebrated. these are the other Trinity hospitals, and you can see we're 78.6. The only one that's higher than us is Chelsea, and they're kind of a boutique emergency department. We don't really count them. So other than Chelsea, we're leading the pack. Southwest, we had a little bit of a down turn earlier, but we've clawed our way back, and so we're doing very well. I'm sorry, this is downtown. So as I said before, our last 2 months are our best so far. Southwest, higher goal, 78.4. And we had fallen a little bit below that goal, but the last couple months we're up above that goal as well. You can see that here in bar graph format. Southwest, again, we won't really count Chelsea, but compared to the other emergency departments, we're really doing great there in terms of patient experience. Here's some more details of what's happening in patient experience hospital-wide. The main one I just want to remind people is we switched from Press Ganey to Qualtrics July 1st. And so we're in this lull between the Press Ganey scores are kind of tapering off, and we're still waiting for the Qualtrics scores to come in, but this is going to come with a bunch of new scorecards and some new information. So we'll be anxiously awaiting when we have enough data to dig into those new features. These are a trend of some of our grievances. You know, the big line here is quality of care. You know, as I said before, you can't have a great experience unless you feel like your care was high quality. That kind of goes without saying. Some other stuff here: care and respect, kindness, appropriate comments, technical skills of staff, pain management, communication between members of the team. So that's making sure that your nurse knows exactly what the plan is, and vice versa, and you're communicating the same thing. Zero harm starts with us, and that's it. That's the end of my quick week summary of updates. Hope you enjoyed it, and as always, my door, my email, and my phone is always open. Have a great day.